You feel perfectly fine. No fatigue. No sugar craving. You even walk a little every day. But when you look closely in the mirror, your body might be whispering, "I'm struggling." In this video, we'll reveal the 15 silent but visible signs of insulin resistance, grouped by where you can spot them: on your skin, face, body, and inside your metabolism. And here's the good news. Every single one of these signs is reversible if you catch it in time. Insulin is your body's gatekeeper. It helps push sugar from your blood into your cells. But if your cells stop responding properly, your pancreas screams, "Make more insulin." This is insulin resistance, the root cause behind not just diabetes, but also belly fat, PCOS, fatty liver, high blood pressure, and even heart attacks. Let's start with what your skin reveals. Dark patches on the neck or underarms, also known as Acanthosis nigricans, are often one of the first visible signs. These velvety, brownish-gray patches, especially in body folds, are a classic early marker of insulin resistance. Mayo Clinic confirms this is often the first external clue in prediabetics and PCOS patients. Next, look for skin tags, especially if you have several on your neck, armpits, or eyelids. They might seem harmless, but multiple skin tags in these areas can be a red flag for high circulating insulin. A study in the Journal of Clinical Endocrinology found skin tags correlated with higher fasting insulin levels. Persistent itching without a visible rash is another sneaky sign. If you're scratching constantly, especially at night or on your back or legs, it might be due to dryness from blood sugar fluctuations. Even before full diabetes, sugar instability affects skin hydration and nerve endings. Now, let's talk about acne. If you're getting cystic breakouts along the jawline, even in your 30s or 40s, it could be a hormonal result of insulin resistance. Spikes in insulin increase androgens and oil production. This is especially common in women with PCOS. Not all acne is insulin-related, but if you're also experiencing other signs, pay attention. A puffy face, especially around the eyes in the morning, can be linked to fluid retention from high insulin levels. When insulin goes up, your kidneys retain sodium. The result is under-eye swelling, bloating, and sometimes puffiness in your hands or feet. Xanthelasma, those yellowish cholesterol bumps near your eyelids, might seem like a cosmetic issue, but they often indicate poor lipid metabolism and insulin dysfunction, increasing your risk of heart disease. Now here's one most people miss: blurry vision after meals. If your eyesight gets fuzzy an hour after eating, it could be a signal that your blood sugar is spiking and crashing because your body isn't processing glucose efficiently. Let's move to your body shape. If you're storing most of your fat around the belly, even if you're thin elsewhere, it's a major red flag. Visceral fat around your organs is deeply connected to insulin resistance. Your waistline tells the truth. For women, anything over 35 inches is a concern. For men, it's 40 inches. That's your metabolic red flag. Now, measure your waist to hip ratio. If your waist is catching up to or exceeding your hip size, you're moving toward an apple-shaped body. This pattern is well known for raising your risk of diabetes and heart disease. Some people develop a visible fat pad on the upper back, often called a buffalo hump. While not always insulin-related, it's been associated with hormonal imbalances, including cortisol and insulin overload. If you notice this along with other symptoms, it's worth investigating. Let's now shift to how insulin resistance feels inside the body. Do you feel unusually tired after eating, like you want a nap right after lunch? That might mean your cells aren't using insulin effectively. You have fuel in your blood, but your cells are starving for energy. Next, cravings. If you crave sugar or carbs even after eating a full meal, it's not just a lack of discipline. It's your body screaming for more glucose because insulin isn't delivering energy efficiently. Frequent urination, especially at night, is another overlooked signal. If you're waking up more than once to pee, Your kidneys might be trying to flush out excess sugar. This happens even before you become fully diabetic. Another surprising sign, fruity or nail polish remover smelling breath. This comes from ketones, a byproduct of fat metabolism when your body can't use sugar properly. In uncontrolled diabetes, this can progress to a medical emergency called diabetic ketoacidosis. If this is paired with nausea, vomiting, or confusion, seek help immediately. Finally, in women, irregular menstrual cycles, missed periods, or excessive facial hair can all stem from insulin resistance. Insulin impacts ovulation and hormone balance and is deeply tied to PCOS. Many women get misdiagnosed with just a hormonal issue, but insulin is often at the root. You might wonder, what's the urgency? Because these signs often show up 5 to 10 years before diabetes is officially diagnosed. And worse, they can predict heart attacks, even in people who never develop diabetes. Insulin resistance damages blood vessels silently. No warning, no chest pain, just sudden collapse. But here's the empowering part. You can reverse insulin resistance starting today. First, measure your waist to hip ratio. If it's high, take it seriously. Second, ask your doctor for the right tests, not just fasting glucose. Request fasting insulin, HOMA-IR, triglyceride to HDL ratio, and fasting glucose together. That gives a clearer picture of your true metabolic health. Third, start living insulin smart. Cut down refined carbs and sugars. Try intermittent fasting if appropriate. Walk after meals to improve glucose clearance. Get 7 to 8 hours of sleep. And, most importantly, manage stress. These 15 signs aren't here to scare you. They're your body's way of saying, help me now, and I'll heal. Catch them early. Act with intention. And you can completely change your health story. Subscribe to Health Pulse Haven for more science-backed tips to reverse metabolic disease. Comment below, which of these signs surprised you the most?